All right. Hey, everybody. I think we're ready to get started. So first off, thank you for joining us this evening to learn a little bit more about health insurance options for folks that live in Iowa. So uh, hopefully maybe you've joined us in the past. We've been doing this now for the last 2 or 3 years. But if this is your first time joining us to learn about the marketplace and a little bit more about the Navigator program, welcome and thanks for coming out. So we'll just be going through a little bit of information and then we'll have some time for questions at the end for sure. So my name is Jeremy Smith. I'm the program director for what's called the Iowa Navigator program. And if you're not familiar, the Navigator program is a free service to anybody that lives in Iowa, just to get assistance in helping you to figure out what insurance options is available, assistance with the application process, and really just anything you might need as far as getting questions answered when it comes to Medicaid, the CHIP program, also known as Hawkeye, and then, of course, the plans on the health insurance marketplace. So hopefully by the end of this, you'll understand a little bit more about the Navigator program and how it may be able to assist you or your friends or your family or your employees kind of understand a little bit of the alternatives to offering group health insurance. And then, of course, kind of how that works for individuals. You'll know a little bit more about exactly what the insurance carriers are offering and how that works. And then, of course, what it's like to work with our program if anybody needs that assistance. So I'll start us off by just talking a little bit more about my organization. So I work with a nonprofit organization called First Choice Services. And I've been here about 8 years now, and it's been a wonderful place to work. We've expanded from less than 40 employees when I started here to over 175 in the last 8 years. So we specialize in social service and behavioral health helplines. So we got our start over 20 years ago now with operating the 1-800-GAMBLER program in West Virginia for folks dealing with a gambling addiction. And then since then, over the last several years, we've expanded and we do the addiction and mental health helplines for West Virginia and Pennsylvania. We do the 988 suicide prevention lifeline for West Virginia and also nationally. We do chats and texts for the whole country if they reach out to 988. We do the tobacco quit line for West Virginia. We have an emotional support helpline. We help answer 211 calls in partnerships with the United Ways. And then we also do these Navigator programs for the states of West Virginia, Montana, New Hampshire, and of course, Iowa. And we noticed several years ago there wasn't any organizations supporting Iowa. And based on our experience of being able to help with social service helplines, we wanted to go ahead and provide our expertise and our service to anybody that we can. So once again, a Navigator organization, it's grant funded from the Centers for Medicare and Medicaid Services, just to provide free assistance for anybody that lives in Iowa that may have questions about health coverage, how to sign up, what they qualify for, and then, of course, application enrollment assistance. So we mainly deal with helping people sign up for Medicaid, the CHIP program, also known as Hawkeye, and then, of course, the plans on the health insurance marketplace on healthcare.gov. So we do all of that work virtually. People can call and we assist over the telephone, or if somebody wants to do it virtually, they can reach out and we'll do it over a virtual platform as well. So like I said, we've been doing the Navigator work for these states for a long time. We started in West Virginia in 2015. We expanded and started doing the work in Iowa in 2018. And we are at this point the only Navigator grantee in Iowa to provide this assistance. And we do it year round, and we do it over the phone, like I mentioned, if anybody needs that kind of help. So the most recent grant that we operate under, it was awarded to us in 2021 for a 3-year period. So we just started that year 3 of the grant, and that will go until August of 2024. And then, of course, we'll reapply for the opportunity to continue the program. But this most recent grant, we was actually able to expand the program and get a little bit more funding. So we was able to increase the number of navigators that work here so that we have more capacity to help more people. We also was able to bring in some Spanish-speaking navigators as well. And then, of course, we have a language translation line if somebody needs assistance in a language other than English or Spanish. So, we've got all this capacity. We want to make sure people know about the program. That way they're not just trying to wing it or trying to do it on their own and maybe get confused. So a little bit more information on the health insurance marketplace. We mainly use the platform on healthcare.gov to help people look at the different individual insurance options that are available. That application also allows you to apply for the financial assistance that is there that helps you pay for the plan that you've picked out. And then there's also, depending on your income, there's some additional help that may be able to lower your deductibles and copays. And then also that application on healthcare.gov, it will also screen you to see if you're eligible for Medicaid or CHIP as well. So kind of the idea is kind of a one-stop shop application to make sure you can figure out what you qualify for. Now, all the plans on the marketplace, there's a variety of different plans to choose from. So there's bronze level plans that are offered, silver plans, and gold plans. And the bronze plans, they tend maybe to be doesn't cost very much per month, but the deductibles might be a little bit higher. And then that goes all the way up to the gold plans that may cost you a little bit more per month, but your deductibles and copays are going to be lower. So your gold plans are going to be your 80-20 plans. The silver plans are going to be more of your 70-30, and then your bronze plans more in the 60-40 range generally. So anything that's offered through the marketplace, it has to be a company that's in good standing with the state and the federal government. They have to cover all the same things. So they can't pick and choose which kind of healthcare they want to offer to you. They all have to offer what we call essential health benefits. And then also anybody that offers a plan on the marketplace, they have to offer at least one silver and one gold plan. And then what they charge has to be the same as on the marketplace versus off the marketplace. And then speaking of the essential health benefits, this chart here shows us what these plans have to include in the plans that they offer to everybody. So every plan has to offer, things like hospitalization, mental health and addiction treatment, preventative services, lab tests, prescription coverages, and more. So this way you don't have to try to worry about what's in the fine print. You're going to know anytime you look at a plan on the health insurance marketplace, they're mandated to at least cover these things in the essential health benefits category. Then speaking a little bit more about the preventative care, all of the plans on the marketplace, if you sign up for any of the plans, it comes with free preventative care as part of the plan. And these lists change just a little bit from year to year. But, this is going to be stuff like, immunizations is going to be covered, your yearly exams, certain colorectal cancer screenings if you're of a certain age, and other kinds of screenings as well. So anytime that you have a plan on the marketplace, you can always count on it having to cover the preventative care for free as well. So who's eligible for a marketplace plan? You do have to live in the United States, and you have to live in a state that's served by the marketplace, which Iowa is. You have to be a U.S. citizen, U.S. national, or lawfully present immigration status as well. And then also you can't be currently incarcerated if you want to be able to sign up for a marketplace plan. So this part tends to be the most confusing part for most folks when they're trying to figure out how the marketplace works. And so what makes the marketplace a good option for folks is if you can't get insurance from another avenue, if you can't get insurance through your job, or if you can't qualify for Medicare or Medicaid, most people qualify for what's called the advanced premium tax credit. And what that is it's a monthly subsidy that helps you pay for the plan that you pick out. And it's based on your family and your family's situation. So what they're going to look at is, are you married? How many tax dependents do you have? What's your estimated annual income for 2024? And then, of course, also your age can come into a factor. So what this does is based on all of those things. When you fill out an application, the government will decide if you qualify and how much monthly subsidy you may qualify for. And then you can apply that to the plan that you've picked out. And this has changed a lot over the last 3 years. The amount of subsidy in the form of the advanced premium tax credit has increased pretty significantly. And so what that means is that more people qualify than ever. And also the amount of monthly subsidy they qualify for has went up as well. And what that's translated into is that the majority of people that's getting their insurance on the marketplace can find a plan at starting within less than $10 a month currently. So like I mentioned, if you can't get insurance through a job, if you don't qualify for Medicare or Medicaid, most folks qualify for this advanced premium tax credit, and it helps pay for the plan that you've picked out on the marketplace. The other form of financial help that you can get if you're applying on the marketplace, if you're under 250% of the federal poverty level, you can also get a break on your deductibles and co-pays in the form of what's called a cost sharing reduction. And so what this does is if a plan normally has a certain level of deductible or co-pays, if you're under 250% and you pick out a silver plan on the marketplace, it automatically lowers your deductibles and co-pays. So by doing the marketplace application, it's going to be able to show you if you qualify for that. And most people that's under 250%, and if they're looking at those silver plans, they're very happy with the prices that they're seeing after this cost sharing is implemented into their plan. So the reason that we're doing this webinar this evening is it's a very important time of year to pay attention to health coverage if you're shopping for it right now. The annual open enrollment period for the health insurance marketplace, it's going to launch on November 1st, 2023, and it will go until January 15th of 2024. And so during this open enrollment period, this is when you can sign up. If you currently don't have coverage and you need health coverage, you can sign up. Or if you're already signed up for a marketplace plan, this is the time of year where you can switch your plan. You can update your application and make changes. So really busy time of year for anybody that's shopping or needing to make updates to their marketplace health insurance. So the first date I just want to definitely point out to folks, for anybody that wants their coverage to start right away on January 1st, you have to sign up between November 1st, and December 15th. And so as long as you signed up by December 15th, your plan would start on January 1st. If you sign up anytime between December 16th, clear up until the deadline of January 15th, then your plan will start on February 1st, 2024. So like I mentioned, it's just a really important time to spread the word, let people know if they currently don't have health coverage or they're trying to figure out their options. Open enrollment is when you want to look at those options through the marketplace. So the other really big thing that's been going on in the world of healthcare in 2023 is there's been a lot of changes with Medicaid, and maybe you've heard about it. Maybe you've heard people talk about losing the coverage or needing to redo their applications. So I wanted to talk a little bit more about what's going on in the world of Medicaid right now. So during the pandemic, we obviously know that, especially as it hit, a lot of people was laid off, a lot of people lost their jobs. And so at that point, Medicaid was there, and a lot of people signed up for Medicaid, and they needed health insurance. So what happened during the pandemic is the federal government and the states decided to waive the mandate that people have to renew each year to keep it. So a lot of people that got on Medicaid over the last, 3+ years, they was just kind of locked on to their Medicaid coverage during the pandemic. But now that the pandemic is over, we're going through a period of what we call the renewal process. And what that means is that everybody's mandated to go back through an annual renewal and reapply to make sure that their income is still within the qualifications of the Medicaid program. And so if somebody misses their renewal and they don't fill out the paperwork, or if they do fill out the paperwork and they're shown to be over the income qualifications, people may lose Medicaid right now. And this has been going on for several months. So we have seen a lot of people lose the Medicaid coverage that they had, and they may have to try to find alternative coverage. So there's a couple different options that people's going to have in a lot of cases. First is going to be checking with their current employer to see if their employer offers health coverage to them. And in most cases, employers are going to be able to give their employee a special enrollment period to sign up through the employer if that's offered. If it's not offered through your employer and you lose Medicaid, that's when the marketplace can come in. And they've made some special rules around people that's lost Medicaid. So if you lose Medicaid or you've already lost Medicaid, you can qualify for a special enrollment period through the marketplace, clear until the end of June 2024. So even if for something happens and you miss this open enrollment period I've been talking about, if you've lost Medicaid, you can still take advantage of this special enrollment period through the marketplace. So it's just really important, if you know anybody that currently has Medicaid, make sure that they know that they need to have their address up to date with the state Medicaid office. And they definitely need to respond to mail. And if they get a packet that they need to do their renewal, they need to be looking for that and get it in on time by the deadline. Because like I said, if they don't do their renewal, they risk losing their Medicaid coverage. And then, of course, also, if they're over income, they also may lose the coverage, and they may want to look at this marketplace special enrollment period if they need coverage for them and their family. So some of the other major updates that's been going on with the marketplace over the last couple years, we finally got to fix what we have always called the family glitch for the marketplace. And what that means is, in the past, if somebody was married and their spouse's job offered them coverage, the offer alone pretty much knocked them out of being able to get a marketplace plan with those monthly subsidies I was talking about. So what they've done is they've finally been able to update the rule, And now, if you're married and your spouse's job offers you coverage, if it's deemed unaffordable, then you can opt out of it and look at a plan on the marketplace with the subsidies. So we had heard for years that spouses was getting locked in this family glitch situation. So we're really trying to get the word out that they need to come back and look again. So if they're trying to look at their spouse's family plan and they think it's unaffordable, they may want to look at marketplace this year, because maybe they can opt out and get a more affordable situation. The other thing that I've already mentioned is the plans are more affordable because the advanced premium tax credits have increased. So people can qualify for more of them to put on the plan that they've picked out. And people have been very, very happy since this happened. Like I said, the majority of people at this point can get a plan for starting at less than $10 a month. And so even if people have looked at the marketplace in past years and maybe they weren't very happy with it, they should look again. Now, with all these updates, they may be looking at a lot better situation. The other major change that happened last year was even higher income earners can qualify for subsidies now. It used to be that if you made more than 400% of the federal poverty level, that automatically knocked you out of being able to get any subsidies whatsoever for your marketplace plan. They've kind of now done away with that cap. So now it just continues to be income based. And even if you're making, quite a bit more than 400% of the federal poverty level, you still may qualify for some of those subsidies that can help pay for your insurance plan on the marketplace. So we have 3 carriers in Iowa that's offering plans in 2024, and these carriers have been around for a long time in Iowa now. They offer a lot of really great plans. So we're still looking at Medica, Wellmark, and Oscar offering health insurance plans to folks that live in Iowa. Medica and Wellmark will serve statewide, and Oscar will offer plans in 75 counties. So it's definitely, some really good options for folks to be able to shop around and look and see, which plan might be best for them and their family. So we're really glad that these 3 carriers are still here. And then we've been talking a lot about marketplace, but we also help try to figure out if people can qualify for Medicaid or Hawkeye. So here's some of our income levels that people can make and still be able to qualify for these programs. So if anybody is interested in trying to, sign up for these, you can always reach out to a navigator and we'll help you through that process as well. So if anybody's interested in receiving free assistance from a navigator, like I mentioned, we're a free grant-funded service just to either answer questions you may have or help you through the application process. So we at this point still have plenty of capacity to help folks. We have started booking appointments with people that we helped last year. But we still have capacity right now. If anybody's interested in getting a little bit of help, you can give us a call. Some of the things that you may need when you're ready to actually do the application, you're probably going to need dates of births and social security numbers for yourself and everybody in your family. You're going to have an estimate of what you think your 2024 income will be. And that's going to be your family income if you're married. And then also you're going to want to have a list of your doctors and the medical facilities that you usually use and a list of your prescriptions. And that's just so we can help you figure out if the plans are going to cover those prescriptions and those doctors you work with, and help you figure out which plan might be best for you and your family. So just to recap, a lot of the options that people are going to have when they're looking for health insurance. Of course, there's group insurance. So if you're going to offer health insurance to your employees, or if you work somewhere that offers a group plan, that generally is what you want to sign up for. But if you don't have that option at your job, that's when a lot of people is going to be looking at Medicaid if they're income eligible, CHIP if they're income eligible. And then if that doesn't work out, we've got these plans on the health insurance marketplace where the majority of people can qualify for this advanced premium tax credit that helps pay for the plan that you picked out. So we're always trying to get the word out. We want to make sure that everybody has health coverage. We know that people that have health insurance are healthier. They tend to be able to go to the doctor more often. They can catch little problems before they become big problems. So our goal is to always make sure that everybody's at least looked into all of their options when it comes to being able to insure them and their family. So if anybody has ideas for us to do future, presentations, or if you have a place that you can put up flyers, please reach out to us and we will mail you business cards or flyers, whatever you can do to help get the word out to more people so that we make sure everybody can have good quality health coverage. This is our contact information here. So we are in Monday through Friday from 7 a.m. to 5 p.m. And then if you need special appointments, if you maybe need some Saturday availability or some evening availability, reach out to us. We always try to be flexible. Like I mentioned, we have navigators that speak English and Spanish, and then we have a language translation line as well. So we really want to try to help as many people as possible. If you go to our website, acanavigator.com, and if you go to the Contact Us tab, you can actually even book your own appointment with us, and we'll call you at the date and time that you've selected and help you through that. So if anybody has more ideas, or if you would like us to send you some flyers, you can email us at navigator@firstchoiceservices.org, and we'll send you out whatever you think you can use. And then, like I said, we're really just here to help. So if people have questions or they need anything, you can always reach out to us, and we're going to do whatever we can. So at that point, I'll go ahead and open it up for questions. It doesn't look like we have any in the chat yet, but feel free to put it in the chat, or if anybody wants to unmute yourself and ask anything, I'll do whatever I can.
Jeremy?
Yes.
Trisha here. I had a question on who deems the health insurance that an employer provides for their employees as too expensive.
So the marketplace actually has a formula and a definition that they use each year. Last year, I'm sorry, I don't know it exactly off the top of my head right now, but last year it was right around 9.5%. And this year they've lowered it a little bit. It's going to be 8 point something. So what that means is that if your family's annual income is more than, and the insurance is going to cost more than let's say 8.5. If it's going to be more than like the 8.5% of the annual income, then it's deemed unaffordable, and you can opt out and go on to a marketplace option at that point. Any other questions people could think of?
Jeremy. This is Tammy from the Child Care Bureau at the Department of Health and Human Services. And one thing that some child care centers have considered over the last year or so is that they have tried to provide health insurance through private policies or group policies for their employees. And quite a few centers have realized that they can provide and offer through the healthcare marketplace better quality health insurance policies through the marketplace at a lot lower costs that are affordable for their employees. So
Yeah.
going with that option rather than trying to navigate providing health insurance through a group type policy for their employees, it is a much more viable option, and really a strategy as far as a compensation strategy that centers can use for their employees.
Yeah, we've definitely had some folks reach out to us over the last couple years, and what we can do in that situation, if you're trying to weigh your options of what might be best for your center, um, we can do price quotes for people based on the family situation. So, for example, if we're trying to run a scenario of, let's say, a 28-year-old female that makes $35,000 a year on average, we can give you that hypothetical situation of how much the plans might be. Or if somebody's married, and has a couple kids, if we know the zip code of the area they're in, and then we have an estimated annual income for their family, we can get you the price estimates on what the plans will be through the marketplace. So we've definitely had some people that own a child care center reach out to us and kind of went through these hypotheticals just so they can get an idea of how much the coverage might cost their employees. So if anybody is thinking about that option, you can definitely reach out. We're happy to try to run those numbers for you and help in the best way we can. The only other thing I will mention that I haven't before, and this is just something else to consider, there is this is the only thing that they can upcharge when it comes with the marketplace, but if a person uses tobacco products, the price of the marketplace plan can increase, sometimes pretty significantly. So that's something else to consider. But other than that, the majority of the people are really happy with the pricing right now, and we're happy to kind of get you those price quotes. I wish we could just put it out there on exactly how much it costs, but it's so situational. It's based on, somebody's age and zip code, and if they're married, and what the annual income is in order to get that quote and help somebody figure out what it's going to cost. But we can definitely try that with you if anybody wants to reach out. All right. Any other questions that anybody can think of? Okay, it looks like we got one. Yeah. So where did you say we can find these applications were? So all of this, we use healthcare.gov. That's the official application for the health insurance marketplace. That's where you can figure out if you qualify for the subsidies. That's where you can see if you qualify for Medicaid or CHIP. And then that's how after you've done the application, that's where you can select the plan that's going to be best for you and your family. So that's the official application. If anybody wants to give it a try, it can be somewhat confusing sometimes, which I think is why we're here as navigators. So if anybody wants the help as they go through the application, or have questions about it, or you would like us to do the application for you, that's where we can come in. So you can go to acanavigator.com and reach out to us to book an appointment if anybody wants the assistance. I hope that answered your question. If it didn't, please let me know. Any other questions that anybody can think of? All right. Well, I think that's all the questions we have. Once again, if anybody does need anything or has any ideas about how we can get the word out, please reach out to us. We're like I said, we want everybody to have good quality health care, and we want to help.
I have a quick
anybody we
question.
can.
I have
Yeah,
a quick
go ahead.
question.
Yep.
Okay, so what if an employer offers insurance
Mhm.
for the employee and this is along the line of the spouse? What about children?
So if the family plan is deemed unaffordable, that's when they can
Right.
opt out of the family plan and go on to the marketplace.
So if if the parent, she's a single
Mhm.
mom and she got kicked off of Medicaid.
Mhm.
And if her plan, so she would have to take what the employer offers.
If
But
it's
with
if it's
with the
deemed be
family.
affordable, right? If it's
Right.
deemed affordable, or I mean,
Okay.
you can
Oh,
you can
okay.
always look at
Okay.
CHIP as an option too.
Okay. All right. Thank you. I'll let her know.
Okay, you're welcome. All right. Last call. Anybody else got any other thoughts or questions? All right. Well, I think we can go ahead and wrap it up then. I really appreciate everybody coming out this evening. And like I said, if there's anything we can do, please let us know. But once again, thanks a lot. We appreciate it.
Thank you, Jeremy. We appreciate you helping out Iowans here with the Iowa Navigator. And look.
Yeah.
Thank you.
Bye-bye.
Bye, everybody.
Bye-bye. Thank you.